Did you know a tiny bacterium, possibly living in your stomach right now without causing any symptoms, could secretly be setting the stage for serious long-term health problems? Even cancer.
It sounds kind of wild, right?
Yeah.
But that's one of the surprising things we're unpacking today.
Yeah, we're taking a deep dive into Helicobacter pylori, this incredibly common bug.
And we're pulling insights from a talk by Professor Barry Marshall, one of the researchers who famously linked H. pylori to ulcers. This was originally presented via EBS.
Right. So what's fascinating here is how something so widespread and often, totally silent
Can have such profound hidden consequences.
Yeah.
Our mission today is really to guide you through what the sources reveal about this often overlooked passenger.
How it can cause these chronic issues, maybe contribute to cancer development through a really unexpected cellular process.
And also why getting rid of it is becoming more and more of a challenge, especially now with antibiotic resistance.
So even if you don't feel a thing, this little organism might be doing damage, maybe over years.
Exactly. Understanding that long game is key, both for prevention and, knowing what the fight against it looks like today. There are some pretty clever strategies emerging.
Okay, so it's a dive into how these tiny things inside us interact with our bodies over time. Let's start with just how common H. pylori is. The sources really stress that a huge number of people are infected.
Maybe their whole lives, yeah.
And they never experience any symptoms. They're just asymptomatic carriers.
That's a really critical starting point because, as the material points out, even without those obvious symptoms like pain or ulcers, the bacterium is causing damage.
Okay.
It triggers chronic gastritis, which is basically ongoing inflammation in the stomach lining.
And this inflammation just sticks around.
It persists for as long as the infection does. Often that means a lifetime. And that chronic inflammation, even if it's low level, that's really the root of the long-term risk.
Okay, this is where the puzzle pieces really start to get interesting for me. How does just chronic inflammation from a bug, even a lifelong one, how could that possibly lead to something as serious as stomach cancer down the road?
Yeah, what's the connection the sources describe?
Exactly.
Well, the proposed mechanism they outline is actually quite intricate. It involved the body's own repair system.
Our repair system? How?
Okay, so when H. pylori causes this chronic irritation and, damage to the stomach lining, the body tries to fix it constantly. And this involves sending in the repair crew specifically, stem cells that travel from the bone marrow.
From the bone marrow?
Yeah, through the bloodstream. They kind of detect the damage in the stomach and migrate there to help regenerate the lining.
So our own bone marrow is dispatching these emergency repair teams to the stomach.
That's a good way to think about it. But here's the catch the sources reveal. Over many, many years, this continuous cycle of damage and repair using these migrating stem cells, it can lead to significant abnormal changes in the stomach lining.
Abnormal changes, like what?
Two key changes are highlighted. First, something called intestinal metaplasia. That's where the stomach lining begins to look and even behave more like the lining of the intestine.
Whoa. The stomach starts acting like the intestine?
Sort of, yeah. And this is noted as being very common in H. pylori-infected people, especially in populations like Chinese, Japanese, and Koreans. The thinking is it stems from these bone marrow-derived repair cells settling in and, differentiating incorrectly over time.
Okay, that's one change. What's the other?
The second is gastric atrophy. This is damage to the glands in the stomach that produce acid. So you end up with very low stomach acid levels.
And is that bad?
The sources specifically call gastric atrophy a very high-risk lesion for stomach cancer.
Wow. Okay, let me see if I've got this. The constant irritation from the bug makes our body send stem cells from the bone marrow to fix it. But over decades, this repair process itself can cause the stomach lining to change, maybe look like intestine or lose its acid glands.
Basically.
And that's what really ramps up the cancer risk.
That seems to be the mechanism, yeah. It's fascinating, though, concerning example of how the body's attempt at chronic repair can sometimes go awry, creating an environment ripe for malignancy.
So given this mechanism and how long it clearly takes, who's most likely to be affected by H. pylori-linked stomach cancer?
Well, based on that timeline, the sources point squarely at older individuals, people who've been infected with H. pylori for most, or maybe even all, of their lives.
So even if fewer young people are getting it now in places like, say, Korea.
Right. Their parents or grandparents who might have carried the infection for 60, 70, 80 years, they'd be the ones at highest risk because of all those cumulative changes.
And what does this mean for, like, prevention or catching it early, especially for those older groups or in high-risk areas?
The material strongly advocates for testing for H. pylori infection. If you have it, treating it could potentially reverse or at least halt some of those precancerous changes.
Okay, testing. What else?
Beyond that, in regions with high prevalence and risk, like Korea, there's a recommendation for routine endoscopic screening.
Looking inside the stomach with a camera.
Exactly. For nearly everyone by their 40s or 50s, this lets doctors visually check the lining for those signs of trouble, like atrophy or metaplasia.
Okay, that makes sense. Now, cancer is almost never caused by just one single thing acting alone.
Sure.
The sources mention that H. pylori might be doing something else too, right? Not just causing damage directly, but maybe changing how other factors affect the stomach.
Yes, this raises a really important point. The sources introduce this powerful concept that H. pylori acts as a potentiator.
A potentiator, what does that mean?
It basically means it makes the damaging effects of other things you encounter much, much worse.
Like it turns up the volume on other risk factors.
That's a great analogy, exactly. Yeah. And the key evidence highlighted for this comes from a really crucial study using Mongolian gerbils. This was done by Dr. Tatsu's group in Japan.
Okay, gerbils. Unpack that experiment for us. What did they actually do?
So they split these gerbils into groups and gave them different things. One group got just a high-salt diet. Another group got just a specific chemical carcinogen, a known cancer-causing agent called MNU.
Okay.
Another group got just H. pylori infection. And in all those individual groups, they saw very little, maybe even no, stomach cancer developing.
So salt alone wasn't a huge issue, the carcinogen alone wasn't, and the bug alone wasn't either.
Right, but then they started combining them.
Ah.
When they gave the gerbils the chemical carcinogen plus H. pylori, they started seeing some cancer develop, maybe around 15%.
Okay, so the bug plus the carcinogen had an effect.
But here's a really crucial part, the bad combination they describe. When they gave the gerbils the carcinogen plus H. pylori plus the high-salt diet, the rate of stomach cancer absolutely jumped to like 30–40%.
Wow. That's a massive increase compared to any single factor or even just the carcinogen and the bug together.
Huge difference.
So it's like H. pylori kind of created this susceptible environment, and then the high salt somehow amplified the carcinogen's effects within that environment. Is that the idea?
That's exactly what that study demonstrated so powerfully. If H. pylori is present, things that might cause only minor damage on their own, like a diet high in salt or exposure to certain carcinogens, they become far more dangerous.
So H. pylori potentiates these other risks. It dramatically increases the likelihood of developing carcinoma.
Spot on.
That's a really powerful insight. It's not just the bug acting in isolation, but how it interacts with our diet, our environment. It really highlights the complexity here.
Absolutely.
Okay, so if H. pylori infection is such a major piece of this puzzle, the logical step seems to be, well, treat it, right? Get rid of the bug.
You'd think so.
What do the sources say about the current state of H. pylori treatment? Is it straightforward?
Well, this is where we hit a significant challenge. The sources express real concern because H. pylori is rapidly becoming resistant to many common antibiotics.
Resistance, like a superbug.
It's described as, in some ways behaving like a kind of superbug because of this growing resistance.
That's a worrying trend we hear about with lots of bacteria. How bad is the resistance getting for H. pylori specifically? Are there numbers?
Yeah, the material cites specific numbers showing declining cure rates. Historically, treatment combinations aimed for maybe 95% cure rates. Very high.
Right.
But now, depending on the specific drug regimen and the region you're in, those rates are falling down towards 80% or sometimes even lower.
Wow, that's a big drop. So treatments fail more often.
It means initial treatment often fails,
Yeah.
which requires multiple rounds of different antibiotics. And sometimes the infection is already resistant to the first-line drugs even before treatment starts.
Okay, let's unpack why this particular bacterium seems to develop resistance so quickly, especially to certain antibiotics. What's its trick? What's its strategy?
This is actually a fascinating genetic detail they mention. The reason H. pylori becomes resistant so rapidly to some antibiotics is because, unlike many other bacteria, and certainly unlike our own cells, it does not have a robust system for checking and correcting errors when it copies its DNA during division.
Wait, it doesn't proofread its DNA, it just lets mistakes happen.
Essentially, yes.
Yeah.
It's got a high mutation rate. So if a random mutation occurs that just happens to give it away to survive an antibiotic,
Like pure chance.
pure chance.
Yeah.
For example, the source uses metronidazole. If a mutation inactivates an enzyme needed to make that drug effective inside the bacterium, well, that mutated bacterium just keeps dividing and thriving because the error wasn't caught and corrected.
So its sloppy DNA copying is actually its superpower against certain drugs. It allows resistant versions to just pop up really quickly.
That's a pretty good way to put it, yeah.
Yeah.
Its high mutation rate allows it to generate these resistant variants rapidly, particularly to drugs that rely on being activated by bacterial enzymes or interacting with specific bacterial components that are prone to these random mutations.
Okay, so given this genetic quirk, this sloppy copying,
Yeah.
are all antibiotics equally susceptible to this rapid resistance?
No, thankfully.
Which ones are still reliable, according to the source material? And which ones are maybe risky to reuse?
That insight into its mutation strategy really guides the choice of antibiotics now.
Yeah.
The sources highlight that resistance is thankfully very rare for a few specific antibiotics. These are generally reliable, even if other treatments have failed.
Okay, good. Which ones fall into that more reliable category?
Bismuth, like in Pepto-Bismol, but prescription-strength amoxicillin and tetracycline are listed as the ones where resistance is uncommon.
Right.
These can often be key components of successful rescue regimens if the first attempt at treatment doesn't work.
Okay, bismuth, amoxicillin, tetracycline reliable. What about the other side? Which ones should doctors be cautious about, maybe only using them once?
Yeah, the material advises using certain antibiotics only once, precisely because resistance develops so quickly due to that high mutation rate we talked about.
Makes sense. Which ones are in that group?
This group includes metronidazole, which we mentioned, clarithromycin, the quinolones like Cipro or Levaquin, and the rifamycins like rifabutin or rifaximin.
So for those, if a treatment using one fails,
It's highly likely the bug has become resistant, so you wouldn't typically reuse that specific drug. You need to switch tactics.
okay, it sounds like a much more targeted approach is needed now. You really have to know how this bug behaves with different drugs. How is treatment evolving to deal with these challenges? And the fact that every infection might be slightly different.
Well, that brings us neatly to the modern approach described in the sources: precision medicine or personalized medicine.
Precision medicine, we hear that term a lot now. What does it actually look like for treating an H. pylori infection?
It means moving away from the older, sort of a one-size-fits-all approach, where doctors might just prescribe a standard combination of drugs and hope for the best.
Right.
Instead, it involves a more detailed assessment. Looking at the patient's history, of course, but critically, trying to understand the specific H. pylori strain that's causing the infection in that individual.
How do you do that?
Well, it can involve more sophisticated testing, sometimes even culturing the bacteria from a stomach biopsy.
Growing the actual bug in the lab.
Exactly. To directly test its sensitivity or resistance to various antibiotics right there in the lab. The goal is to pick the absolute best antibiotic combination tailored specifically to that person's infection.
So, testing the actual bug from the patient to guide the treatment. What are the main benefits of doing that?
Well, primarily, it leads to higher cure rates because you're using drugs that you know are effective against that specific strain.
Gets it right the first time more often.
Hopefully, yes. But there are broader benefits too. By getting it right more often, you reduce the overall amount of antibiotics people need to take,
Fewer drugs overall.
which means potentially shorter treatment courses, maybe fewer side effects for the patient. And importantly, it helps combat the larger global problem of antibiotic resistance. We're using these precious drugs more judiciously, more effectively.
That makes a lot of sense. It's a smarter way to fight back.
It's the 21st century approach, really.
Okay, so this whole deep dive started with just one bug, H. pylori, but the sources kind of end by broadening the scope, looking at the entire digestive system. What's next in this area? What's the bigger picture?
Yeah, the sources definitely hint that H. pylori is just one player, albeit an important one, in a much larger ecosystem inside us.
Right.
There's ongoing research into the vast number of other organisms, bacteria, viruses, fungi that live in our gastrointestinal tract. And many diseases of the gut are still not fully understood.
But what kinds of diseases are they thinking about?
Well, diseases mentioned include inflammatory bowel disease, things like colitis and Crohn's disease, and also irritable bowel syndrome, or IBS.
Which is super common, right?
Very common. The sources note it affects maybe 5–10% of populations in places like Australia and Korea. So significant numbers.
And the thinking is the other bugs might be involved.
The focus is increasingly shifting toward the gut microbiome, that entire community of microbes, and the complex ecology of that community. How do all these organisms interact with each other, with our diet, our environment, and our own bodies? That's becoming a massive area of research for understanding these other conditions. It's moving beyond just single pathogens.
Wow, what a journey this has been. We started with an often silent bacterium, H. pylori, learned how it can cause chronic inflammation, trigger this bizarre long-term repair process involving our own bone marrow stem cells.
Yeah, quite amazing.
Which can lead to precancerous changes like metaplasia and atrophy. Then we saw how it doesn't act alone, but can supercharge the risk from things like a high salt diet, shown so clearly in that gerbil study.
That potentiation effect is key.
And then we looked at the tough fight against antibiotic resistance and the shift towards precision medicine, guided by understanding the bug's own genetic quirks, its sloppy copying.
It truly highlights how seemingly small, persistent issues can, through these really complex interactions over long periods, lead to significant disease.
Yeah.
And it also shows how crucial detailed scientific investigation is, digging down even to the genetic strategies of a microbe to tackle these challenges and find better solutions.
So what does all this mean for you, listening? This deep dive into H. pylori, that gerbil study showing how it boosts carcinogens and salt effects. It reveals the surprising power of interaction over time, even with seemingly minor factors. It really makes you wonder, doesn't it? Given the complexity we saw here with just one bacterium and the mention of this broader gut ecology with, potentially millions of organisms.
Trillions, problems.
Trillions. How else might the vast, tiny world inside us be interacting with our environment, our diet, even our own cells in ways we are only just starting to grasp?
That's the big question, isn't it?
Definitely something to think about until our next deep dive.